And Varun, can you?
Varun is there.
Varun Sagar is here. Let's see if anyone, Varun. So Varun Sagar is a communications expert that's been working in the Ayurveda space for some time. He's an expert in how to brand, how to communicate, how to market, and he has many, many insights on how Ayurveda is just not coming into the space of articulating. Varun, thank you so much for being at AYUSH HARDTALK today. Could you please share with us some of your thoughts? Varun? Oh, I think you just muted yourself again.
Good evening, namaskar. How are you? So just give me 30 seconds. I'm in a noisy area. I'll just get into a peaceful area and join back.
Okay.
Thank you.
Yes, and Krishna just unmuted also. Krishna, could you unmute and speak? If you see yourself on the participant screen and moved into the panelist screen, it means we're going to have you speaking very soon. Krishna, can you unmute yourself? Yes, you're there. Please.
Thank you very much, ma'am, for giving this opportunity to speak here. I'm just a medicine student.
Which kind of?
I'm doing ma'am, general medicine, MD3.
Okay.
Where are you located, Krishna?
I am in beside the Mexico. Here is the valleys, Iceland, San Pedro.
Oh.
And I am from Lucknow.
Very happy to have you with us. Now, I'm
okay,
curious.
thank you. Okay, thank you, sir.
Your comment. How did you find this seminar?
I find the seminar from the Facebook, ma'am. I follow on Facebook to you, and from 3 to 4 years.
How was the quality of the seminar?
The quality was good, ma'am, but I did not find the main point. Was this is the point for the what is the this seminar is about homeopathy, allopathy, and Ayurveda. How to combine these all the medicine for the better treatment for the patients. So that topic was different, but I write some different comments here because I don't like to submerge Ayurveda. I know this is the treatment. I know this is for human quality. This is for us. We are treat patient by the treatment of the many things, many way we treat patient. But the Ayurveda is the way to treat. As I know, as the ancient history of the Ayurveda told that we treat patient by the in the Ayurveda, as I know, that is the very different way. And the thinking of...
But you are a general medicine doctor yourself?
Yeah, ma'am, I am general medicine doctor.
And you prefer the use of Ayurveda. So why didn't you study?
Yeah, ma'am, Ayurveda. No, listen, please. I want to... This is not my profession. This is my personal thing. This is my base of the life, Ayurveda.
So my question,
and why I joined medicine, this is not a profession. I will never like to speak in the public, what is the Ayurveda, this is like that. No, Ayurveda is the very different. This is for personal things. I don't want to make it the professional, but I like to treat patient if any patient is suitable for this thing, because this is the need purity, patient, very patient, very purity need for the Ayurveda.
So even though you believe in Ayurveda in your personal life, you are...
I believe because I feel.
Yes.
Because I am the person. Maybe it is some psychological problem, but the things I feel nowadays in the COVID, I was not aware of this. When I was in India, I was free. I enjoy. I like every person. I enjoy a lot in India. I travel across the India. But when I came in this COVID-19 era, this is not only the only one problem is the corona. Lots of things happening in the nature, unbelievable things I saw here. In the people's behavior change, manner change, their psychological behaviors and everything. So this is not only the problem can be solved by the only vaccine. You can see, you can observe, and especially in the side of the ocean side, the people are living
Tell me
very hug.
where you're located.
I am located near the Mexico. Here is the Belize country.
Belize. Okay.
Belize. Not good country, not very educated highly, but yeah, there is the Iceland, San Pedro.
Okay,
It is,
are you in Central America?
yeah, I'm here.
Okay. So I understand from you that professional, you are trained in modern allopathic medicine, but you also believe in the Ayurvedic system of medicine. Yes?
Yeah, I believe, I respect both.
Great.
Both have their own value. Without both
Yes. Thank you for sharing.
education, both medicine work together.
Thank you for sharing.
Yeah, ma'am, thank you. Your thanks.
Yes.
Okay, your thanks.
Yes. Varun, can you come back? Are you in a quiet place now? Good. We can hear you. Varun? Oh, now I can't hear you.
Varun, we've lost Varun. Is Pepina available to talk? Pepina? Hello? Pepina? Pepina?
Varun, if you, that would be great. Your microphone is on. From this side, it's not muted, but we can't hear you.
Okay, can you hear me now?
Wonderful.
And now, perfect.
Varun, we can hear you. Hello?
Oh, you just muted out again.
Am I audible now?
Yeah, audible.
Now you are.
Okay, finally. So good evening, namaskar again. I'm in a quiet place. I've been a part of this webinar since the time it started at 4:30 till now, and very interesting conversations is what I've absorbed here. And a few relevant points which have basically come up because I come from a marketing background, and I am working in the field of in the sphere of Ayurveda, and there is something very exciting which is coming up which I would not like to disclose at this particular stage. We as a group are working. Or should I? So it's something that very exciting is basically coming up, and this has been a very interesting conversation which I've basically learned and heard.
Talk to us. Wait, since you're not going to tell us what's exciting coming up, Varun, can you tell us something that you think needs to happen so that Ayurvedic people can use their communication skills better to transmit the truth of their medicine to the larger world, to policymakers, and to the allopathic doctors who don't believe that they have a science or who are in opposition to them? Could you lend us some wisdom on the things that they need to be doing?
Yeah. So the first thing which I've come to understand from today's conversation also here is that there is a lack of communication skills amongst the Ayurvedic practitioners in India. And we need to be, building a community wherein there could be some authors or some speakers who could basically teach them in terms of how to communicate with patients and how to communicate with the outside world. So that, if the communication is correct, then the respect level for Ayurvedic practitioners can increase manifolds. So there has to be a system which has to be created wherein maybe, groups of people are created, groups of people are basically formed, and you have, good quality speakers such as you, Bhaswati, who can basically take it forward in terms of, teaching them. Secondly, which I've also noticed is that, proper documentation of, the practices of Ayurveda are not readily available for other practitioners to basically follow. So I think the system needs to be also created wherein documentation of practices and, of treatments are done in a very scientific manner, which is basically in times to come respected and referred to. That's what my take on the entire thing here is.
Okay. And when are you going to reveal the secret thing that you want to tell that's exciting that's coming up? Is it a policy or is it a program or is it something that people are doing?
Yeah, so it's not a policy, it's basically a program. So there are multiple streams on which we are basically working on. One of them, of course, is building a very big community in India for Ayurvedic practitioners and followers, which is not only limited to Ayurveda, but it's Ayurveda, Yoga, Unani, Siddha, and Homeopathy. So very soon we are going to be coming up with India's largest online exposition, which is going to be focusing on this particular stream, which is then eventually going to be converting into an offline exposition, which will happen in 4 different cities in India, and then eventually it will go outside of India also. It's a very large, community that we're building.
Okay.
Varun, is it too early to share details with us on the chat box, or
yes, I think I will take another week's time.
And this is CII Global Ayurveda Summit, is it? No.
Well, it's very, very different from what CII has done. CII is, unfortunately, although I respect CII as an institution, but whatever they've done as far as the Ayurvedic conference is concerned, quote unquote, or I would say, I shouldn't be saying it, it's a very shitty show which they conducted. So the show which we are basically going to be having here is extremely immersive, extremely entertaining, extremely informative, and it's going to be one of its kind show which I don't think anybody in the world would have experienced till now.
That's
Thank you so much. We look forward to receiving more information. Bhaswati, could I bring in Dr. Kamal?
Oh, Kamal, yes. Thank you, Varun, for sharing.
Kamal Krishna Banik, and then Dr. Kiranlal, please.
Dr. Kamal Krishna, could you unmute your mic, please? You'll have to unmute your mic. Okay, we'll wait for you. Dr. Kiranlal, can you unmute your mic? Dr. Kiranlal, yes. You did unmute and then you muted again. Yes.
Hi. Thank you, Dr. Bhaswati. And thank you, Madan. And it is very full and informative sessions. And really very much integrated and from different spectrum. And it's really, really appreciated. And I was here for a long time. And I'm audible, no?
Yes, you are.
Okay, very good. So currently just want to share you something regarding these acceptance. That's what we were talking. And in Germany recently, we have a position paper published by the government authorities about Ayurveda. I think Dr. Madan might have been very well aware about that.
Yes.
And that paper really shows, it's really an incredible recommendation about Ayurveda. And they would like to, the recommendation goes like this, that they would like to recognize Ayurveda as a presentation medicine. So this is the first time a European country or a Western country has came to recognize Ayurveda in this way. The only problem is that our industry probably may not be interested because they were not ready to, may not be prepared to go to that level. So the issues happens in different areas. First of all, whenever we talk about Ayurveda as it originated as a holistic medicine and from his homegrown backgrounds in India or in other South Asian countries. So it has its own limitation to convert into a business. And when I studied in Trivandrum Ayurveda College, and when we were studying, it is the only primary objective is to get a job, to have a very decent salary. So from there, it was all, it's all in the head of Ayurvedic doctor to build his career, to build his pharmacy, to build his prestige, build his fame, everything. It is no one ever in the history of any of this educational system has to face this kind of pressure, because you have to be everything. There is no other way. So this is what if you ask what is your specialty, you are in business, you are making medicines, you are giving classes, you are a trainer, you are a pharmacist, you are a therapist, you are a doctor, you are what not. So this kind of pressure is there, and that is all, we all go through that situation. And finally, when we, for example, from the conservative group, people like Bhaswati and all, everyone is trying to say, okay, Ayurvedic doctor, you are like this, you are like that. So this is the situation. You have to understand how we came through. And then at the same time, we have pressure from different groups, which is saying, okay, I have Ayurveda, I learned it from my great grandfather who came to my dream. And then he has more mileage in our market than a institutionally qualified Ayurvedic practitioner. So we have to fight with the quacks. We have to fight with the allopathic doctors. We have to fight with everyone. And the entire Ayurveda in my life was a fight, nothing else. So this is the background, and so here also we are continuing the same thing. When you come to Europe, some people will say, "Oh, you are a academic graduate. You are not a traditional healer, so you don't know how to diagnose or how to learn classical Ayurveda." And even in US also, in Facebook and all, we constantly engage with these kind of discussions like that. So this is one basic issue what we face in our day-to-day life as an Ayurvedic practitioner. So I've been in different countries. I was working with the different regulatory agencies, but in my experience in last 20 years, I will say that this one, the German position paper was one of the best I have ever seen, and it is really recognizing Ayurveda from its fundamental core. So I think I really request Ayush Valley team and Dr. Madan and Bhaswati and all to take up this, because this is the first time Germany has came up with something like that. This is a very strong EU member. And then from our side also, the Italy, France, and Belgium also coming together to have some kind of recognition. So recognition for the medicine. So this is what we are expecting. So it was wonderful, and really thank you, Bhaswati, for your leadership. I really appreciate, and nice to see you. And thank you, Madan. Okay.
Thank you.
Thank you very much
Kiran.
for the
So
panel.
just for the participants, Kiranlal studied Ayurveda in Trivandrum and is now based in Germany, and he's doing a lot of work for Ayurveda in Europe. And I have also presented here the link to the document that Kiran is talking about. So please do consult. The document is in English, in German, unfortunately, but it's easy to understand. You can use all the web-based resources to follow the text. Thank you, Kiran. You raised a very, very important point here. Thank you for sharing your email contacts too.
Great. Can we see if, thank you. Can we see if Dr. Kamal Krishna Banik is ready to unmute his screen? Dr. Kamal Krishna, Dr. Banik, or else we move to Dr. Jagveer Rawat.
Jagveer, please. Thank you. Jagveer.
Could you please unmute? Dr. Jagveer.
Jagveer,
Yeah.
can you? Okay.
Yeah.
Thank you for joining us.
Hello. Good evening and best wishes for this very important webinar. I'm going to contribute 3 points. One is me and Bhaswati had shared in World Ayurveda Congress at BHU. That is the contribution of the veterinary medicine. Well, that can be a very good bridge between the allopathic system and Ayurvedic system of medicine. As we share several, animal models for curing the autoimmune diseases and some non-infectious chronic diseases, the animal models can be, starting point. And we are working also in few of the conditions like chronic kidney diseases and some autoimmune diseases. So that can be a beginning that bridge. Veterinary medicine can provide the bridge. And we don't have a veterinary Ayurveda college as well, or nowhere in the world. So this is the first point I want to make. Secondly, there is a continual emphasis of my university and my department on One Health as a new way of defining it, where we combine the food issues from agriculture perspective, and where the three type of the food like sattvic, tamasic, and rajasic can be even produced from the field size. Production system can change. So agriculture can be incorporated. Environmental health has to be incorporated. Like in our country, there are huge issues from the environment pollution, which are the kind of the burden, the burden on immune system. To say that like the chemicals are one burden, then the practices in the developing countries are also, the food production practices are also the kind of the burden. So second perspective is of mine is that there has to be some one health curriculum defined at the degree level. And we have an opportunity near Delhi in Haryana, a place called Badsa, where All India Institute of Medical Sciences has its New Delhi has its extension center. So there we have the land for from IIT Delhi also. So we need a lot of integration in the system medicine perspective, where bioinformatics and the data science has also to be integrated. So one health has to be viewed in a very, very different way. And the leadership can be provided by your panelist, Dr. Gupta. Yogender Gupta has already said that he could be a catalyst in that. Dr. Madan is here, Dr. Bhaswati is here. So third point is about the Ayurvedic veterinary college. I am making these 3 points uh, to the discussion and to the panel. And
Jagveer, would you like to make some comments? Now, Gupta, if Guptaji was here, you could have addressed him directly. But if you share with the group here, we can convey this to Guptaji, to Professor Gupta, on how you see a dialogue developing between the veterinary sciences and the medical sciences and Ayurveda, using that one health thinking that you just mentioned. Is there something else you want to add, or is there something else you would like to share with us?
yes, Dr. Badam, actually our university is considering a report on integration of all these systems and starting a college of one health system, already mandated by our chief minister. Secondly, Patanjali is also interested into starting Ayurveda Veterinary College or One Health and want to invest in heavily into it. I had a discussion with Acharya Balkishanji on that, and they are very happy. And I had discussion with their vice president of research and development, Dr. Anurag Varshney. So the thing is that the conditions are very, very conducive to Dr. Gupta, to reach out to Dr. Gupta and have a joint project on some diseases like even COVID. COVID is our good conditions where they this Patanjali came into in a bit of a controversy also, because they had an immunomodulating type of intervention, Corulin, and I was invited basically by them to whether this can be put up as a cure also. So in the treatment, there's a very, very different perspective required. So when we, like leaders like Patanjali, they have to reach out from immunomodulation to immunotherapy, or you can say the therapeutic area. There's a lot which can be, thought of how to do that. So this is one case. Then there are autoimmune diseases, 1 or 2 autoimmune diseases, chronic kidney disease, 3 conditions at least we can have from India side, and
Thank
Dr.
you.
Gupta can intervene.
Thank you, Jagveer. You know, the Ayush Valley Foundation would very much like to draw you into our discussions in these things. So thank you so much for sharing your comments here. And we will continue this discussion offline, because you are indicating some very important opportunities and important directions that need to be completed. Thank you. Thank you for sharing. If you are happy for us to draw you into these dialogues, we would very much like you to be with us. Thank you. I have Bhaswati ji, I would like to bring Nalini Gite. Nalini is a very seasoned Ayurveda Vaidya. Nalini ji, can you hear us?
Could you unmute? Yes. No, you were unmuted again. Yes.
Nalini ji, let me just give a brief introduction. Nalini ji studied Ayurveda in Maharashtra several decades ago, and she has been involved with very large Ayurveda initiatives working with the Tatars, and Nalini ji is responsible for the medicinal herb garden that was established in New Delhi in Raj Bhavan, in the President's Palace in New Delhi. And Nalini ji was also very deeply involved with Krishnamurti schools, both here in England and in Rishi Valley in Andhra Pradesh. So we are very honored that you have joined us, Nalini ji, and the floor is, we welcome your thoughts and comments. I want to also say, Nalini ji is always critical of the way we appreciate Ayurveda, that is within the Ayurvedic community. She says we are always too divorced from the fundamental principles. So Nalini ji, all yours. We are here to listen to everything you have to.
I really means the panelists are so knowledgeable, so educated, and really intelligent. And I'm just a student, still student, because my teacher doesn't appreciate what I'm learning and how deep I'm learning. Maybe Bhaswati may know the Tiwari from BHU. She was with her reader in BHU. Now my teacher is 82, and still she feels, and I also strongly feels, that unless and until we understand the fundamentals and philosophy of Ayurveda, which is based on Veda, we will not really understand, because whatever we are discussing is all symptomatic for symptomatic treatments. I have tried to teach in the schools basic Ayurveda to the primary or middle school children.
Right.
We created many gardens around the Rishi Valley in school children, in the village children. Of course, Rishi Valley has a big garden, and I used to treat Rishi Valley children as a immunity to improve their immunity in epidemics and all. And that worked very well. But then I realized that we don't have the basic pure herbs. So I started growing herbs 25 years back. And then I grow many herbal gardens in all over India. That is my passion. So I do not have a name or frame that for that. I wrote the books for my projects for Tata's and for Science and Technology Department, which is for private circulation. Primary books for the common man and school children, how to use, why to use, how to grow the medicinal plants for day-to-day problems. So all that I have done, but then I realized that I myself have to learn a lot. So I started learning after I left a few years back to Rishi Valley. And my teacher is very, 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 disciplined, and he's one of the most knowledgeable person in field of Ayurveda. But she is mostly now in Vedanta, Shankaracharya Vedanta. So she's frustrated actually, the way the policymakers and the way the doctors or experts in Ayurveda look at down upon the Ayurveda. So she is not into it. But I am still learning. We still many times learn Charak Samhita first part only. And she says everything is in that first part, Sutrasthan. And
Nalini ji, we are so lucky that you are here with us, and I don't know at what point you joined the discussion.
No, I'm from the beginning.
Beginning, okay. So I'm happy that
I heard everybody and I appreciate it, but I strongly feel that unless each one of us live Ayurveda, understand the philosophy, and here I mentioned the first Sutrasthana from Vagbhata, Ashtanga Hridaya, that the shloka, Ragadi Rogan, Shatatanusaktan. In that, as per my understanding, I feel he is talking about unless the person has read Veda, understood Veda, and then come to learn Ayurveda, the real understanding will not there. And that understanding of Veda is also not live in his mind as a residue. There is no residue of any knowledge. So that empty mind, when start learning the Ayurveda, then there will be the understanding of what the sages has done for the humanity.
You know, I want to say something, Nalini. There is a movement right now going on for the past 10 years to bring Sanskrit to the Western countries. And when the Indians who are modernized don't give any credibility to Ayurveda, Shashi Tharoor says it's a dead language. People in Delhi say Sanskrit is not a good language for to hold.
Yes.
Then they are very confident in what they say, and they disparagingly say things down about Sanskrit. Then when the Western people are teaching Sanskrit in their universities, Germany has many programs for the
I know.
learn, right? Now, I just got an email last week from a great group in Houston, Texas, which has bought land, and they're starting a Sanskrit university in the USA, and they're asking me to contribute. And I said, yes, please go ahead. Tell me exactly how I can contribute. They want me to contribute on Ayurveda because they believe that the personal responsibility of a person, every citizen, needs to be for his own healthcare. And when we have people in India, like the Rashtraam School of Public Policy, creating programs in Ayurveda wellness with Dr. Mala Kapadia, or we have programs that are outside of the Ayurvedic stream, people that are saying, you know, we are going to do things for the international community. Then what happens is Indians are all offended. No, Sanskrit is ours. It belongs to us. Ayurveda is ours. It's India's. People stole yoga. They took it to the West. Are Baba, Indians didn't do yoga. That's why the people from other countries came to India, learned yoga, took it back because they couldn't practice it here because they're foreigners, went back to their countries and started yoga studios. Ayurveda in this country, if they had treated the Ayurvedic physicians properly, many of those people wouldn't have gone to the USA or Canada or Germany or South Africa to go and practice Ayurveda there and settle Ayurveda as a medical system in those other countries. And now it's happening with Sanskrit. And if Indians are going to continue to be so ridiculous about their attitude towards Sanskrit, what is going to happen is that the rest of the world is going to start taking it up. It's already got many things that you said about it in that is quite superior. So I think Indians better wake up, because there are people like me. Not everyone can come and live in India the way that I am to commit myself toward moving Ayurveda. And even people like me who are from, you know, we're considered foreigners because of whatever reason. When we come back home after getting educated in other places, we are treated like shit. We are treated like crap.
I found whatever you said is a very valid actually. And I'm glad you are doing this great job of, you know, bringing all the things together. Only thing I would like to say that yoga, whatever is reached in West, it is not the right yoga. If you learn the Patanjali Yoga Sutra, what westernized yoga I saw for last many years I'm visiting. I have conducted Ayurvedic and yoga workshops in Germany, in Netherlands and many other places earlier, but I have left all that because I see the futility of all that. It is all very superficial people want. But true yoga is, you know, yogas chitta vritti nirodha. Just take the one sentence. It will take you a lifetime to learn that. Vritti, what is the vritti means? Many people have, I was discussing with my teacher. She said, vritti and laya are the very different meaning. They are 100 meanings. But what you will take here? Laya is be one with. With one with that Almighty is the ultimate aim of yoga. And what we do today, we just concentrate on body and flexibility. But that is not, there is a one part. There is only one stanza on asana.
What is
Sthira Sukham asana.
So you're saying Laya versus Vritti. What does Vritti mean then?
Vritti is the waves which occur in your mind. Like the Vani, Para, Pashanti, Vaikhari, Madhyama. These are the 4 legs of the Vani. So from Para to Vaikhari, it takes time. And meanwhile, if you observe that, it will stop in before Vaikhari, before you utter the word. And it is a three layers of yoga: mental, emotional, physical. So it won't, don't find people are teaching this. People are teaching only how to make your body flexible, and how to attain the final pose through postures, which is impossible. So this is happening in Ayurveda also. So I would like, which I have done with my students, while teaching them yoga, or while taking the Ayurveda in different way to the village schools. I have published material, charts and all that, but I don't think that is important. But if you want really to children to understand yoga, we have to take it simpler way from the schools and the policymakers has to involve in that. I met many times ministry, because I have worked for many ministries regarding environment and Ayurveda. But they showed no interest, ministers, central ministers. So I gave up, and now I'm really happy with whatever I'm learning of Krishnamurti and learning of Ayurveda from my teachers. Which I think maybe next life I will be able to do something with the policymakers.
Well, we are very happy that you are here with us.
Thank you.
Nalini ji, thank you so much for being.
I'll make a philosophical statement, please. And that is that we only see around us what we are philosophically ready to see. So when we see people who seem to just be those flitting hatha yoga people that don't quite get it and they think a 200-hour program is it, that's what we see. Because I've also seen in the United States some of the best yoga teachers who really understand yama niyama. They understand what pratyahara is, they understand what dhyana is, and they know what karma yoga versus bhakti yoga is. And they're really practicing yoga from the mind, the body, the senses, and the spirit. And the senses is oftentimes left out by people that say mind, body, soul. So when we evolve to that place, suddenly those people appear in front of us. And I've seen some of the most gifted people living in Europe, Canada. I was just in Panama a few months back before COVID hit. In South America, they are so correctly understanding. But sometimes what we see are those loud noisemakers who are trying to commercialize, trying to get the attention, trying to, it's driven from the ego and not from the actual sense of Vigyan. And so if you look for those others, I think they are also there. I certainly know that they are there in California and New York and Texas, and they are also here in India. And in fact, I'm living in India right now because some of the most profound teachers of today are young, amazing Sanskrit speaking, Ayurveda practicing, yoga understanding, plant-based, animal respecting, farming people. And they are really the future if we can just not criticize them, but let their energies, emanate in echoes.
Yes, I think, all these good things from Vedas or from all Asian science, the seed is there, always there. So in appropriate time, in favorable conditions, it will sprout. So I'm not worried about Ayurveda or yoga disappearing or Veda disappearing. It will never, because they are all eternal. We are very, very impermanent. So
you are a person that has to till the soil with me so that we can make the soil ready. So when
that is what you do, and not worry about the fruits. I am still in contact with many small groups, young minds, and you do whatever appropriate for that group and for that time.
Yes.
I'm not in a big stage, sorry, so I do not have the habit of talking to the mobs and all. I am happy with the small groups dialogues.
Nalini, could I share your WhatsApp number with a few people?
Yes, please. Do, because I'm more comfortable with the one-to-one dialogue, which is very profound, I find.
Several people are asking how to contact you, and I'm going to take the liberty of sharing.
Yes, please share my email. but Google email is more, safe. This Ayurveda email is not.
Can I send them your WhatsApp number?
Yes, WhatsApp number and also the Ayurveda email.
Thank you.
Yes.
So this
Thank
is
you, Dr. Nalini.
Yes, yes.
We're wondering if, yes, anything else?
Yeah, if anybody is interested in the material which is in Telugu, Hindi and English, it is without my name, they can use it because I don't want my name publicly. So the charts and some booklets are ready and anybody can use that. I can give the soft copy to Madanji and he can give it to the people who are interested in working in the villages.
Thank you very much.
there are many people who are responding to your comment about villages, especially Jagveer ji from Haryana, who wants, I've just shared, and Jagveer ji has one question. Could you take 1 minute just to tell us about the difference between Vritti and Laya, Nalini ji, before you go away?
Yeah, Vritti is kind of waves which occur in the mind or brain or buddhi. And Laya is you are one with the universal consciousness. And Vritti is with the consciousness, subconscious and conscious mind, it keeps playing. But that Vritti, when they lie with the universal consciousness, then you are in Samadhi. Hello?
Yes.
So when in that time, this is, but we cannot only talk about it. We cannot imagine it. So because then there is no me to tell this. It is the intellectual knowledge.
Thank you so much. I think Jagveer ji will have many, many more questions for you.
Yes,
Yes.
yes,
And
yes.
he is especially interested in the school children in Haryana and how to introduce
Okay,
this.
because I have a Hindi material, so I can share that material, but not to publish in my name.
Okay.
They can use it for the well-being of village children freely.
Thank you
problem.
so much. Thank you. Thank you. We want, now you are part of this Ayush Valley Foundation family, so we will call upon you for help as we go along. Thank you.
But Madanji, one request that I'm, as you know, I am not very familiar to have a discussion with the big mob or many 100, 200 people. The small group will be, I'm happy to share whatever little I know.
We will
Thank
keep
you.
it to, we will keep it to small. We will keep it to small groups like this one.
Yeah.
Thank you so much for being with us. Thank you so much.
Thank you. Bye
Now,
bye. Bye bye.
we still have about 22 people online. Bhaswati ji, how are you for stamina? Do you want to continue?
I want to finish because I actually have another event that started.
You have another event. But before I go offline, I'm just trying to see if there is somebody who wants to.
Anik was going to speak. We didn't hear from him.
Yes.
I was very happy to hear Nalini's voice because I want to meet her. But
Nalini is here in Cambridge right now. She's right now just a few streets away from me in Cambridge. So I'm very fortunate to have Nalini ji here in Cambridge. Although we haven't met because of the COVID issues, we are in constant touch.
But we can always get on video calls like
now,
yes, it's nice meeting you, Bhaswati. Really nice meeting you.
You have much to discuss. We have a lot of things to discuss. So I'm happy that you are here with us. I don't know if Nirmal is still here. Nirmal?
I don't see Nirmal here. I see that either we should take Dr. Banik off of the panel because he's not unmuting.
Yes.
And I think Jagveer has spoken, so he's done. Papina, do you want to say anything? If not, we should take, I've been trying to become a co-host, but they will not enable me. I don't know what has happened to Yegu. He's not making me. Maybe Madan, maybe you can make me co-host so that I can help do some of these admin tasks.
Where are you?
I'm wondering if Dr.Oriparambil is available to speak and would like to say something. Dr. Madan, did you? Okay, great.
Hello.
Namaste.
Hello.
Namaste. So thank you, Dr. Madan and Bhaswati. Actually, it's a great pleasure to listen all this great discussion on this platform. I'm in Kerala now. Hello.
Yes.
Yes. So actually, I'm leading the new interdisciplinary research unit proposed by the Department of Ayush, Government of Kerala. So now we are trying to do this technology incubation in Ayush. So a lot of interesting initiative we are trying to initiate here after this international conclave. So two key points are, one is like the documentation of the clinical works which is happening in this Ayush clinical network run by the government of Kerala. Actually, we have a good interdisciplinary team. Basically, I'm a physicist and I'm trained in nanomedicine and I have postdoc in kind of quantum biology. So we are working on a kind of systems of biology-based approach in establishing the scientific evidences towards this Siddha, Ayurveda, and homeopathy. So what the main problem we are facing here is the kind of lack of support from these policy makers. So what is my observation on this kind of point is that, see, we have a WHO and kind of great international agencies to support maybe like issuing guidelines and all these things. But in our sector, there is that kind of muscle power. We are lacking that from a kind of international level. Like suppose Ayush Valley, hopefully, like we have to have a kind of alternative body to provide this kind of guidelines, issues in this. See, for example, COVID pandemic, all of we know that Siddha Kabasura Kudinari is working very nicely in Tamil Nadu, and Ayurvedic formulations are doing a great job. And in arsenic amalgam is a single compound. We actually distributed to more than I think 2.5 crore people in Kerala, especially, and we run a study and we got a very wonderful results, which is on kind of non-specific generation in healthy patients. But the problem is that we are lacking a lot of infrastructure and communication network. So we are to convince these kind of policy makers, we need a kind of a cohesive approach. For that, I think I usually kind of networks can help us to generate these kind of policy and guidelines. So hopefully it's a kind of great deal you are doing. So I'm very happy to join this team. Thank you so much.
This is actually a very important topic because I find that everyone says, if only we had more funds and we had more infrastructure, that would be great. But then I ask them, tell me what that infrastructure looks like. And all they can do is talk about some vague idea of what that infrastructure could be, and they cannot give details. So
I have a comment on that take. Actually, my take on this point is, now this government is demanding the Ayurveda sector to produce the evidences. To produce the evidences regarding the clinical efficacy, we need a mechanism to document it. So, for example, in Kerala,
means mechanism to document. What does it mean?
See, the mechanism to see in government dispensary networks, we have more than 1,500 dispensaries across Kerala run by with the government funding. So these Ayush clinical networks, the clinicians, doctors, they will just do this kind of regular kind of job, and they will feed some data through AIIMS, Hospital Information Management System. But those data sets are insufficient to generate a kind of quality document. So see, even though now Ayush Ministry is a lot of case taking formats, all these things are generated by the central councils, but it's not disseminated properly to the state level.
Because I think everyone knows this. What exactly is needed within that hospital information management system to change so that it will get
from interdisciplinary point of view, see, we have ICD classification. So see, we can't fix this, take this Ayush and fit in that frame. So what we need is a kind of standard case recording format.
So why don't you invent that case recording format. I have asked doctors at BHU and at SDM that why don't you, I mean, the government official is not going to come out with a case recording format because they don't know clinical medicine. Why don't we as clinicians come out with that case recording format ourselves and then take it to those officials, because all they can do.
The problem is there must be a uniform kind of approach. So what I'm trying to do now is to develop some kind of formats and at least to distribute it to the government medical officers who is running this job in Kerala.
Sir, but it has to be piloted and it has to be checked. I've seen a lot of case recording formats for COVID, for example. Okay, and I'm a person who was director of research at my New York hospital for 10 years. And I will tell you, I look at those case recording formats of Ayurvedic doctors in India and I laugh at them. And then I ask them, how many of these were filled up during your treatment of COVID? No, we couldn't use the form. Why couldn't you use the form? You were the one that made it. Actually, there were some problems with the form. So I go through question by question with the students or the residents or the young doctors, and they can't even use the form. So I say, so why don't you change the form?
That's a problem. Actually, WHO, they have given one format. So in allopathic system, they are using it. So like that, why don't we think about a kind of guidelines and...
Why don't you just make it? My question is, why don't Ayurvedic doctors make it? They knew COVID was happening. They knew they were not permitted to be in the system in the month of March. That's 31 days in March. April, after Modi ji spoke with everyone on March 28th or 29th, he invited them to do something. Where are the clinical intake forms for COVID? Where are the research documentation forms for COVID? I started creating them. I created a research working group. I begged to be on the Kerala working group with Rajmohan V, with Madam Shailaja teacher. I went to so many groups up at the central level saying, I have these documents. I have a research background. I have an allopathic background. I have an Ayurvedic background. Please, let's get these case results. In Goa, they had 250 patients of COVID. Many of them were foreigners. They had the chance to show the data beautifully. They couldn't even get the forms together properly. So that after they treated the patients, they had no documentation and they were forced by the allopaths to get on the stage and say, no, we didn't treat anyone. Why?
That's a problem. There's a problem because here COVID is managed by the modern system. So this Directorate of Health Service, DHS, is having all the data with them. So there is a kind of lack in sharing those data. For example, in Pathanamthitta, one district, we did some work. Actually, we covered almost 90% of the population with the homeopathic immunobooster. And now some documentation work is going in that line. But the problem is, see, we have one Amritam. I think Dr. Rajmohan, he is doing that documentation. But if you get the final document, surely I am damn sure that that will miss the critical points which will make that document valuable. So that's the...
Sorry, why is it missing those crucial points?
Because there is a lack of this kind of initiative among this thing. So you see, we are. It's like, see, if we get some this kind of international guidelines on collecting this clinical information in complementary medicine, like there's something, if you your group can collectively do, it will be a better thing.
It's not someone else that has to do it. It has to be the Ayurvedic doctors that go into the literature and do their homework. Ayurvedic doctors do not do their homework. They do not go into the literature, which is all there. It's all online. They don't even know how to write a damn case guideline. The care guidelines have been up for 7 years, 2013. And I do not see Ayurvedic doctors taking those care guidelines and using them. What prevents them from going online? They can do it to watch their TikTok videos. Why can't they do it to get onto PubMed? I had someone tell me, well, actually, those are not publicly available. I said, yes, they are. Pub is public. And just find that document. They don't know how to search. They don't know how to do this. This is the problem. It doesn't matter how much money is given to them. Right now, we have all this increase of the money that's been funded for AYUSH. You know, I see it. The people do not know how to use those funds. You hire someone for a position, like I can, take names, but I don't on this forum. And you look at the position they have and you look at their competence level. They can't even do the basic things. They don't know how to do a lit search. They don't know how to write a case report. They don't know how to write up a basic guideline. There is someone in Delhi who has had hundreds of patients and she can't even write a case report. What's going on with that? They sit on journals. They are the heads of big, committee names, but they don't have basic competence. And this is not going to get solved by increasing funding. When you just said, let's increase the funding, who is going to be competent to do that? And the people that are competent are not allowed to participate. There is some kind of mafia that says, don't hire him, don't hire her, don't hire him, so that those people stay suppressed. I know.
But now things are changing because of this COVID pandemic. The situation is very, very, very hard for the Ayush system, especially in Kerala. I think in Tamil Nadu, they have an integrated approach with Siddha medicine, and in some ESI hospital, we are running homeopathy, even at the second line. But in case of Kerala, we are still in this COVID frontline treatment. That itself is handled by the allopathic system of medicine. But I think if the cases are rising up now, so soon there will be a realization that there must be a kind of integrated approach. Otherwise, we can't take off this kind of a huge burden coming out in terms of, I think, resource management and also in human resource management. It's a very challenging time ahead in Kerala. So anyway, it's a great opportunity. Thank you.
Nirmal, thank you so much for adding. Bhaswati, you're muted. Please unmute.
I'm not muted right now.
Okay.
Dr. Oriparambil, what you said was actually a lot of what I wanted to hear in the first hour, because it's these kind of things that are actually the bottlenecks that are preventing us from going forward. It's these kind of ideas that if we just have funding, everything will be fixed. But what you just said about human resource development and soft skills, which Dr. Gupta said earlier, and that understanding, which Dr. Eleni said earlier, these are the kinds of things that you have just highlighted that we really need to have on the table in front of those committees who are the decision makers, whether it's Niti Aayog or the people that are going to push forward the NCISM bill into acts and rules, or the mainstream Ayurvedic government doctor who doesn't have whatever skills she needs in order to do her job. That's where actually our bottleneck is. So thank you for your contribution.
To one point, I want to add some point, because we recently started this skill development program with the CSIR, this National Institute of Interdisciplinary Science and Technology, which is in Thiruvananthapuram itself. And I'm trying to pull this kind of interdisciplinary contact to generate a kind of good HR in terms of interdisciplinary scientific research. But the problem is that the clinical outcome is the ultimate. So if you don't document it properly, we can't do any reverse engineering approach on that. So we are looking for a standard clinical intervention data from case diagnosis to the outcome. But since we are, I'm not an expert in this Ayush domain. I'm a trained physicist and I'm in nanomedicine. But I discuss with a lot of experts in domain, but they are very excellent, excellent clinicians and very good doctors. But the problem is that they are also lacking this kind of training. So in what way we can do that? Actually, still I am trying to figure it out. So
Nirmal, I have a comment to make here. Thank you. Very happy to hear that you're doing something with the National Institute in Kerala. The Bhaswati ji is an expert in this. The Ayush Valley Foundation will be very, very happy to join in all these efforts to develop and to fill those gaps that you're talking about. So thank you so much for raising this. We will be in touch offline, and please put your, Nirmal, I have your email address from our earlier interactions. Could you share it again so that all of us can have it too, please?